are treated by female doctors live longer. The study was published in the Annals of Internal Medicine, and it says this could save thousands of lives. Dr. Reena Mehta with Uptown Allergy and Asthma is here to explain the study and the findings. Dr. Mehta, good morning. Thanks for being with us.
Good morning. Thank you for having me.
Really interesting study. I guess, what was it that made them look into this, and what did they find exactly?
And so what they're always looking at gender differences, of course. That's a big topic. And so what they looked at in this recent study published in the Annals was 800,000 male and female patients, all Medicare patients, so ages 65 and older. And what they found was that women treated by female physicians tended to do better and have better outcomes than women treated by male physicians.
So that's just kind of the black and white of it, but did they look deeper into what it was that might have caused this outcome?
Sure, absolutely. And so there's a lot of studies kind of leading into this that have suggested that women physicians or female physicians tend to have better outcomes, and the question is why. And so they looked at this a little bit deeper to say, okay, is it because women are spending more time with their patients? Is it because that men might not better understand women's health issues? What they found in the study was that women basically said that they often felt dismissed when they were being treated by a male physician. It may be that they're not heard as well. The communication when you're typically treated by a female physician is known to be better. Maybe women spend more time with their patients, and so they are picking up on more diagnoses that might otherwise get missed.
And of course, we want to clarify, we're not saying that if you have male doctors, don't go to them anymore or don't go to male doctors in the future. That's not what we're saying at all. That's just what the study has found. And the question I had for you in the commercial break, and you said that's a good point, based on the findings, do you foresee education? So how doctors are trained, do you see that changing at all?
Absolutely. And so this is just kind of the start of pointing out some differences. Now, to your point, my husband is a male physician, and I have several male physicians. So I am not suggesting that, you should go change your doctor just based on this, study that showed.
And one study,
the one study that showed these small differences. But what it does tell us is, let's better understand why this is happening. And so it goes down to the training level, medical school, is maybe we need to be spending more time learning about women's health issues. Maybe in med school, all physicians need to be trained about dealing with and learning about some of the things that are unique to women that maybe get dismissed or get misunderstood. Because if you have a woman come in with chest pain and you sort of dismiss that, it could lead to a bad outcome. And so spending more time with your patients and learning some of the things that are unique to women is really important.
Do you foresee an addition of coursework or lessons or interactions, if you will, maybe just like, one lecture series, if you will, on biases or blind spots that you might have as a male or female doctor? Do you foresee that in med schools moving forward?
I do, and I'm hoping that, as we get more awareness about this, small issue, it does change the curriculum that, goes into the training, that there will be more time spent on that, absolutely.
All right, well, Dr. Mehta, really interesting study. Again, just one study, and again, we are not saying don't go to your male doctors. We all have really wonderful male doctors. It's just what this one study found.
I'm just presenting the data.
Just presenting the data. We appreciate your time this morning.